Hi, this is Dr. Debashish Das, surgeon practicing in Chembur since 1983. We are always scared of a condition called piles. Whenever a person has piles, he visits a doctor and says, can you do it without surgery? Of course, there are piles which can be treated without surgery by a smaller procedure like banding. But piles has to be decided by the type of piles. Every illness in the anal region is not piles. The patient could be having a fissure, he could be having a fistula, there can be other things like polyp, and even a cancer of the rectum can be diagnosed. Cancer of the anal canal, lower part of rectum, can give rise to bleeding. So visit a doctor for your piles or so-called piles and get proper diagnosis done. Once you do the diagnosis, the treatment is specific for different illnesses. Fistula, the treatment is different, fissure, the treatment is different, and hemorrhoids or piles, the treatment is different. Nowadays, lasers are available and we use laser in certain cases. Remember, if you have a hammer, everything is not a nail. So you have to decide what is right for the patient. And a good surgeon can always decide what is right for the patient. There are other modalities of treatment like minimal invasive procedure for hemorrhoids, which is painless and the patient goes home within 24 hours. If you are told by certain organizations and agencies that laser is painless, don't believe them. Laser can also be painful. Laser is just a cutting device. It is not magic. So in certain cases, we use laser to obliterate the piles, which are dilatation of veins. And when the dilatation of veins are there, we can ligate it at the base, at the what is known as the hemorrhoidal artery, and we can also do a ablation of the piles. But every case is not like that. There are grade 3 hemorrhoids where you have to do a formal treatment, but it is not as painful as one makes it out to be. So remember, if you have piles, visit a doctor in your area, a good surgeon who knows how he is doing, and therefore you have to be clear that it is hemorrhoids before going ahead with surgery. So don't have a mass in the anal region which is not a hemorrhoid and get treated by a quack. Go to a surgeon and get treated properly. Thank you.